So lots of vibration, lots of dust. We use these for cutting.
I always thought that a worker got injured, maybe went to the hospital, got well, and went back to work. And when I came here, I realized that maybe 80% did that, but 20% did not do that. And that was my biggest shift, was realizing that some workers had a great deal of difficulty in returning to work, and it wasn't just an automatic. They would recover and return to work. When we're doing return to work planning, it's not uncommon to go out to a job site. And it's really rewarding because you meet the worker face to face instead of just over the telephone. You see what they do, and every worker wants to tell you what they do. And it's interesting, and I've seen some job sites that I was blown away with what that worker had to do with it. And it's always something new, and it's just very productive. And again, you get a good working relationship going with the worker because you meet them face to face, you listen to what they say, you look at what their job is, you listen to the concerns, and you address those concerns.
Okay.
So
Today was great because we got to see with Bell Pacific some of the equipment they use. They do a lot of blasting, so it's a lot of heavy handheld equipment, a lot of vibration as a result of that, very awkward postures, and so it helps us to actually see, because you get the name of some of these pieces of equipment or job titles, and that means nothing. Utility operator. So you actually get to see what that is firsthand, and it gives us a better idea, like how we're going to actually, make that return to work plan work.
anything resembling the last time?
We always get received really well, and in most cases, everybody loves nurses. So they are happy to explain that to you and what they're doing and making sure that you do understand for sure. It's always been a positive experience. I love working with people, so I think that being able to talk to different people and be a big part of their healing process. I think nurses have that ability to communicate well and have an understanding of what they're going through, and I think they value that as well. So when I know I've made a difference for someone that way, it's hugely rewarding.
I love my job. It's a lot of fun. It's very challenging. There's always something new that's happening, and that's what I like about it. It's not predictable. Some days you're rushed off your feet because you're doing home care arranging all day long, and then the next day you're behind your desk just doing phone calls, and then the next day you're off doing job site visits. So there's always something new and exciting going on.